we get asked a lot about cancer, and are there herbal remedies that people can try, either as a preventative measure or if they're going through any sort of treatments that they might want to look into?
Absolutely, and that's that's unequivocally and absolutely. Anybody who has cancer and either chooses natural or chooses an integrated approach using the best of what Western medicine has to offer and the natural world has to offer, they'd be very mistaken not to use them. Now, how you use them, that's a different story. Um, I'll just give you an anecdotal story.
Sure.
Good friend of mine, his name's Dwight McKee. He was a clinical oncologist. First, he was a family practice MD, but he practiced natural medicine, integrated medicine, up in Marin, I believe. And for years, they were working with cancer patients who wanted, hey, what should I take while I'm doing my conventional therapies? And after a bunch of years of doing that, he says, if I'm really going to do this, I better go learn more about oncology. So he got board certified in oncology, practiced as a conventional oncologist for about 7, 8 years in Minnesota, I believe, maybe even more longer. And originally it thought, wow, we're not really doing good on the natural medicine side of cancer treatment. Then when he went into clinical conventional oncology, he says, geez, I thought we were doing bad over there. We're doing horrendous over here. And so that's where he started the integrative approach. And he now is part of teaching physicians and healthcare providers how to appropriately integrate therapies. Other researchers in the UK and in UC Berkeley, Paris Kidd, for example, have done reviews of the literature on, for example, using the medicinal immune modulating mushrooms in association with conventional cancer therapies. And all of these independent reviews every single one, say there's absolutely no reason why this should not be part of standard of care. And in China, it is standard of care. You are always given, whatever the conventional therapy is going to be to kill the cancer, and then there's the supportive therapy to support immune functions so that you don't crash and burn and then die of pneumonia. Because a lot of times, if you've really ever seen anybody go through conventional therapy, it's a race between killing the cancer and killing the patient. You keep going, the patient's eventually going to die. And the herbal medicine, almost, if you look at every bit of clinical work on integrating herbs and even antioxidants in most cases with conventional care, the outcomes are better. Survivability is better, quality of life is better, symptom profiles are incredibly improved over conventional therapy by itself. I had a woman with inflammatory breast cancer, worst prognosis for any breast cancer that you can have. And at the time, there were 2 other women that her oncologist was able to find that also had inflammatory breast cancer. She did everything, pulled at all the stops: radical mastectomy, chemo, radiation chemo, and high-dose antioxidant, high-dose reishi mushroom, Schizandra ligustrum astragalus, which is the typical type of formula that I would recommend for cancer patients. And, guided imagery, all the, mind, body stuff. And her GP, her oncologist, radiologist, first said amazing response to therapy, conventional therapy. Her GP said miraculous response to chemo. And then in a follow-up on her records, her GP said incredible restoration of immunocompetency, which is what all the studies say. There was a bunch of studies done on astragalus at MD Anderson in the 1980s and 1990s by a guy named Mavliget. And a drug company had been actually interested in astragalus as an anti-cancer compound. And but then they pulled the plug on it because they said, well, the crude extract is equally as effective as this synthesis, this isolated compound that we're trying to get, so we're going to let it go. For the next 7 or 8 years, Mavliget was like pulling out his hair saying, why did these guys stop? Who can pick this up? I think it was something like in 19 years of doing cancer research at MD Anderson, he had never seen anything work as broadly and beneficial as an anti-cancer compound, or as a immunorestorative compound than astragalus, but the funding was gone to take it any farther. So I think it's a shame that this is not standard of care. Oh, and to get back to the woman with inflammatory breast cancer, in 1 year, one of the other women was dead, and was dead. In 2 years, the other woman was dead, and 12 years later, this woman got cancer again, and she eventually died. But she had 12 more years, 13 more years of life than these other two that had the exact same diagnosis, exact same time, but did only conventional. She did everything. Now, could it be luck of the draw? Yeah, it could be, but you don't see amazing, miraculous, incredible on most records with regards to response to conventional therapies. And I have never, for 30 years, I've been providing counseling to people with going through conventional cancer care, giving them herbs, giving them supplements, lifestyle stuff, and I've literally never seen a negative from it. I've seen sometimes when seemingly didn't do any better, but never, and most of the time, like with this woman, only have seen positive benefits, nausea eliminated, not losing their hair, not losing their vitality, their immune system being stabilized, and not going into the trash and get a secondary infection, and then recover really fast. So I've never seen a negative. I've seen some neutrals, but never negative, and mostly positives in 30 years.